You may be aware that in the recent budget, the government announced the whole of government drug strategy. It's going to provide more than $189 million from 1819 to 22-23. The strategy provides comprehensive packages of measures to address the supply of, demand and harm caused by illicit drugs and their precursors, with emphasis on crystal amphetamines and opioids. Illicit drugs have a devastating impact across communities, with opioids and ice the two drugs causing the most harm across our country. The government is committed to tackling drug and alcohol abuse. Illicit drugs and the abuse of prescription drugs can have a devastating impact on individuals, communities and their families. People experiencing issues with drugs often wait until problems have escalated to a serious point before seeking help. This can also be compounded by a lack of capacity and services best placed to provide these early interventions within those communities. The government can decrease the likelihood of people at risk and serious harm by getting early help and encouraging and facilitating help-seeking behaviour, promoting existing programs and local support activities, encouraging opportunistic and early interventions, and building on the capacity of the workforce across the health sector. Family and friends do play a very important role, providing support and helping people battling drug and alcohol issues. Greater provision of on-the-ground support to communities and families impacted by drugs is required. Increasingly, families take on the burden of supporting loved ones or try to navigate complex treatments, systems and without help and guidance to ensure that their family member can access the appropriate services at the appropriate time whilst looking after themselves as well. Providing on-the-ground local support services, particularly in rural, regional and remote areas, will ensure that help can be found close to home for these people. It is a fact that opioids contribute to accidental drug deaths more than any other class of drug, with pharmaceutical opioids being the main cause. It is estimated that 1 in 5 Australian adults are estimated to live with chronic pain, which is daily for more than 3 months and experienced in the last 3 months. Sadly, around 25 to 35% of children and adolescents also suffer chronic pain. Up to 80% of people living with chronic pain are missing out on treatment that could improve their health, quality of life and workforce participation, including access to pain specialists and one-stop pain clinics. Chronic pain is estimated to be Australia's third most costly health condition in terms of health expenditure. Awareness of pain and pain management is also low among health practitioners and consumers. Opioid medications are particularly effective for relieving acute and cancer-related pain for those in palliative care. However, increasingly they are being used to manage chronic pain where there is no evidence to support their effectiveness and with significant risks associated with long-term use. You may ask why this is important in regional remote communities, and the Australian Commission on Safety and Quality in Healthcare has revealed that prescription rates in some regional and rural areas are 10 times higher than other areas. The Therapeutics Goods Administration has found that a 30% increase in opioid prescribing occurred between 2009 and 2014. Australia's annual overdose report in 2018 stated that drug-related deaths in Australia have nearly doubled between 2002 and 2016. This is unacceptable. Aboriginal and Torres Strait Islander people are overrepresented in deaths across all drug types, with overdose deaths higher per capita in regional areas than in metropolitan counterparts. This is also unacceptable. This increase can, at least in part, be attributed to a lack of appropriate pain management services. One of the elements of the whole of government drug strategy will be to increase funding of $4.3 million to expand the Rural Health Outreach Fund to support the delivery of rural and remote of outreach pain management specialist services in rural, remote and areas of Australia. It will also support the upskilling of primary care providers in these areas to improve prescribing habits and raise awareness of appropriate pain management treatment. This will provide around an additional 1,100 services across this country each year. These services are intended to be delivered through the current Rural Health Outreach Fund contracts and under the chronic disease management of that contract. We all know that areas of Australia do not have access to specialist, multidisciplinary pain management services, including specialist psychology, physiotherapy, psychology, social work and nursing. Improving access to such services will directly reduce the overuse and potential harms of prescription opioids being used for chronic pain management, which, as we know, is best managed by non-pharmaceutical treatment. These new services will assist in reducing inappropriate prescribing and resulting harms, and also improve chronic pain impacts being experienced by individuals. It is anticipated that funding will complement the associated investments in additional specialist drug treatment services by improving access to appropriate treatments for patients who experience withdrawal and dependency issues associated with long-term opioid usage, who transition to more appropriate non-pharmaceutical pain management services. Education materials will be developed to assist with the awareness of appropriate pain management strategies by primary care providers. The department will develop these in consultation with relevant experienced bodies within the sector. These complementary efforts to provide primary care providers evidence-based information about appropriate treatment options and pathways will also encourage a reduction in prescription opioids being used as primary treatment for chronic pain. So where's the Commonwealth up to with this measure? In line with the Comet grant rules and guidelines, it's anticipated that we will undertake a grant opportunity guideline for the current Rural Health Outreach Fund fund holders. As part of that, they will be required to submit their individual assessment plans about where the services need to be provided, and we are developing new guidelines to support that, and we should have those ready over the next 8 weeks. So whilst the funding is available from 1 July, obviously there's a little bit of a process that has to happen before the money actually flows, but we are endeavouring to do that as quickly as possible, as we know that these services are desperately required out in the regions. And we'll provide the funding over 2 years, from 1920 to 21-22. The funding to be provided to the Rural Health Outreach fund holders is seen to be a core element of ensuring that we can ensure a more preventative approach to the management of pain. I think that in the overall drug strategy, a lot of it is combating things that have been for a very long time problematic, but I think the key feature that was highlighted to government around the drug strategy was actually this element around pain management and ensuring a proactive look at that. So we're hoping that through the additional services that we will be able to reduce the numbers of adverse effects through bad pain management for chronic disease. And on that, we're looking really forward to working with RDN and the other fund holders to implement this measure and hopefully see some great successes produced out there in rural and remote communities. Thank you very much for that. And I might just say happy birthday too, 30th anniversary. I wasn't at the event in the other beautiful location, but yes, it's been a pleasure to be celebrating that with you guys, and hope you all enjoy the rest of the 2 days. Thank you.